Now, almost everyone has a memory deficit. Whether we can call it a true memory deficit or a attention problem is depend upon the type of memory loss and the clinical situation in which we come across it. Most of the memory loss is because of decreased attentions. For example, we remove our spectacles, keep it in a place, we forget where we have kept it. Now, this is a not true memory loss. It is basically an attention or a concentration problem wherein our brain is not registering the event which has occurred. So, these are attention problems which do not require any treatment, but only a little more concentration into the areas or the things that we do in our day-to-day life. Presently, the life is a little more hectic and has become very fast. So, just like a computer, you should, when we work with a RAM more than a hard disk, most of the information is stuck in the RAM and it's difficult to come out. Once it goes into the hard disk, you can slowly retrieve it. So, that is the basic difference between an attention problem and a memory problem. Once you attend and concentrate on a subject, the subject is then taken into the lobes of the brain, which are mainly known as the temporal lobes, and it is laid down as memories. So, as and now when we require the memory, we can always retrieve it. Many of the structures in the brain is needed for memory laying down and retrieving. When we have pathological problems in our brain like major vessel diseases, strokes or degenerative problems inside the brain known as Alzheimer's dementia, we go into the pathology of this particular memory problem or the symptom. Memory deficits can occur in various conditions like ranging from a simple vitamin B1 deficiency, which is known as Wernicke's disease, to major catastrophic degenerative conditions like Alzheimer's dementia, frontotemporal dementias. Although many of the degenerative conditions do not have complete treatment, we can halt the progression or decrease the rate of progression by giving the appropriate drugs. When a person comes with a memory deficit, he has to be evaluated for finding out whether there is a treatable cause or an untreatable cause. So, if we have a treatable cause, it is because of a vitamin deficiency, definitely we can take into consideration treating this patient with vitamins like thiamine, which can sometimes alleviate. Sometimes some blocks or small bleeds inside the brain known as chronic subdural may present as dementia. Some endocrine deficiencies like hypothyroidism, hypoadrenalism can also present as dementia. So, differentiating a treatable versus an untreatable or a non-treatable cause of dementia provides the major hurdle in finding out the cause of dementia. If we make a diagnosis of dementia, we can treat it, we can halt the progression or try to regress the progression of the disease. Thank you.